cut that sugar before the cut. The importance of good sugar control before a surgery is of paramount importance. We have many people who are diabetic right now. So, and the age group, previously it was 45 and above, nowadays above 30 itself, we have a lot of people in the diabetic spectrum. So, sugar control before surgery is of very high importance. You cannot have a sugar of 300, 400 and then go for an elective planned surgery. What will this do? This will lead to complications of anesthesia, complications of surgery such as infection and bleeding as well, and poor wound healing and long or prolonged recovery time. Now, sugar control before surgery is of paramount importance. Ideally, in case you are undergoing an elective surgery, it could be any surgery. You are undergoing a breast surgery, thyroid surgery, a knee surgery, hip surgery, any orthopedic or any neural spine surgery, any of these, good sugar control is of prime importance. Why do surgeons, physicians, anesthetists require this? In case your sugars are very high and you are also passing sugar in urine, it leads to complications of surgery. As I told, recovery from anesthesia is prolonged, recovery from the surgical procedure will be prolonged, high chances of wound infection, and in case you are undergoing a hernia surgery or a ortho surgery like a knee replacement or hip replacement, the implant that is getting put can get infected, and once it's infected, it is a dreaded complication, and it's such a grave complication, probably we may end up removing the implant. So, we advise good sugar control before surgery. A common parameter that is assessed is something called as HbA1c. This gives you a spectrum, or it gives you a general idea how your sugar control has been over the last 3 months. This particular test is normally advised for diabetics, and to see this range between 6 to 7 is a good control. Above 7, ideally you get it under better control and then go for the surgery. In case your HbA1c is 10, going for a surgery may not be a wise decision. Until and unless if it is an emergency surgery, you don't have options. You have to undergo. Probably the infection itself is causing increase in sugar. So that time we have to control the infection. Example, when you have something called as acute gallbladder infection because of a stone, your sugars are way above the roof, we advise surgery so that the sugar gets under control. So this is important. Elective surgeries, clean surgeries, you always have the option to get your sugar under control, then go for the surgery. Sometimes we may ask you to get admitted a couple of days in advance. We start you on insulin. Insulin, once is given, it controls the sugar at a much better level, and we do it in an inpatient scenario. Sometimes you may have to undergo a hernia surgery with partial features of obstruction. Sometimes we may ask you to get admitted a couple of days before an elective surgery to get your sugar under better control. Such cases, we admit you, probably we give you insulin to get your sugars under control. And there's a myth, once I'm started on insulin, lifelong I'll be on. No, insulin can also be temporary, where we put you on insulin to get your sugars under good control. We may continue it for a few days after surgery, and once you're discharged, you will be back to your old medications or something a little different based on the physician's opinion. So, sugar control before surgery is prime. In case, as I previously mentioned, emergency surgeries, no. Take you for the surgery, get the infection under control, automatically sugar tends to drop. So, this scenario, good sugar control, faster recovery is a sequential process. So, we give very much importance to the sugar control before surgery as well as after surgery. This helps in faster recovery, faster healing rates, and limits the amount of medications we need to advise to you. So, cutting down that sugar before surgery is a must and should, and in case you have a planned surgery, a serial monitoring of sugar over, let's say, a couple of weeks is a good habit, as well as it keeps your sugar in check. Sugar in check also leads to general health well-being. Hopefully this was useful. Thank you for your time.